The surgical team consists of the surgeon, a sterile assistant, a non-sterile assistant, and a sterilization assistant. The surgeon is to perform the surgical procedure. The sterile assistant is scrubbed, gloved, and gowned. He or she assists the surgeon during the procedure and may be required to take over if the surgeon is unable to continue. The non-sterile assistant is dressed in a scrub suit and performs tasks that a sterile person cannot. The sterilization room assistant performs any flash sterilization that is required and is responsible for preparing and cleaning the instruments required for the procedure. The following materials and instruments will be required: dressings, local anesthetic, 2 gallipots, a beaver blade, dressing gauze, phenol, a kidney dish, drapes, and betadine. In addition, the following will also be needed: dressing materials, a drawing up and sharp needle, gauze swabs, local anesthetic, clamp, beaver blade handle, a drape clamp, an elevator, sterile scissors, mosquito forceps, pickups, and sterile drapes. Appropriate theatre attire should be worn, that is, surgical scrubs. No jewelry or watches are to be worn below your elbows. Ensure clean, closed-in shoes, rubber boots or clogs are worn. Cover any facial hair with a mask. Wear an appropriate mask with your protective eyewear. Sleeves must be above your elbows. Nails should be short, clean, free of nail polish and acrylic nails. The non-sterile assistant is to open up the drape in a sterile fashion, handing it to the surgeon. The surgeon then proceeds to open up the drape covering the instrument tray. The non-sterile assistant will then proceed to open up the sterile packs, handing them to the surgeon. The surgeon then places all required instruments and materials onto the sterile tray. The non-sterile assistant then pours betadine or chlorhexidine into the gallipot, which the surgeon will then use to scrub the patient's foot. In addition, saline is also poured into a gallipot, which will be used in the surgery. The surgeon will then proceed to set up the instrument tray in ascending order of use of each tool for the surgery, starting off with the betadine scrub, drapes, and ending with the dressings. The surgeon will then prepare the beaver blade. The gauze swab is then prepared, which is used to scrub the patient's foot. It is important to note the ascending order of all the materials and dressings on the instrument table, starting from the scrub and betadine to the drapes, the instruments for the procedure, the saline flush, and the dressings required. The surgeon then proceeds to take one drape, opening it up, placing it under the surgical leg and uncovering the non-surgical leg. The surgeon then picks up the gauze and betadine with the hemostat and begin to swab the foot, starting at the surgical site and making their way proximal away from the surgical site. Once the surgeon is happy that the foot is scrubbed, they are then to proceed to hand over their gallipot of betadine, the hemostat with gauze, to the non-sterile assistant. Using a second drape, the surgeon will make a triangle and ask the patient to lift their leg off the chair. The surgeon will then wrap the patient's leg with the drape, using the towel clamps to hold it into place. Once the foot is draped and scrubbed, the surgeon then proceeds to check that the toe is anesthetized before they proceed with the procedure.